Spiritual Path. My name is Ursula Lentini, and this is my wonderful guest, Dr. Robert Springer. The way of the spiritual path, we talk about the way spirituality shows up for us, or we show up for spirituality. Spirituality meaning our personal relationship with that which creates us, which is divine love, divine power, divine consciousness. The more we're in alignment with those qualities of the aspect, the more we understand who we are as a being, as an expression of that aspect, is the more we get to enjoy spirituality and the path and the way it works in our life. Dr. Springer not only is my doctor, but he's a personal friend of mine. We do the internal family systems work together, and I find Dr. Springer to be a truly holistic person. I call him like a superhuman, and perhaps you've met people like this where they excel in every area of their life, where they're creative, they're articulate, they're smart, they're funny, they're professional. He's an expert in his field. When he starts talking about medicine and the body and how it works together and the different systems, I'm blown away, because you're like a goofy person, but yet when you get into your professional mode, a door opens up and this amazing information flows right through you.
There's a lot shoved in up here.
Yeah. So today I'd like to talk about your practice and how you view your practice, what you bring to your practice, how your practice is different than the normal medical model. There was a Norman Rockwell picture done of a doctor, and there's a little girl, and she has her little doll, and you can tell she's afraid to be at the doctor's office. And he's got his stethoscope up to the little doll, and he's connecting with the little girl, relieving her of her fears, making her aware that this is a safe place, that world of medicine is fascinating, and that's how I see you. So it's almost the old-fashioned way that a doctor should be that you can't even find in today's world. There's so many. The model is the pharmaceuticals pay the doctors every time they write a script. So I've heard about doctors seeing people maybe 6 minutes at a time. What's your problem? What's your issue? Okay, thank you, goodbye. Knowing nothing.
Well, it's sad to say, but the model is now, on average, when you go and see a doctor, you'll be lucky to get 12 minutes of face-to-face time with the doctor. And as often as not, the doctor's already reaching diagnostic conclusions about what's going on the basis of the intake information that the nurse or the assistant took. And so I've had patients relate to me their experiences in other offices where they went to see a doctor and the doctor was literally writing the prescription as they were walking in the door. I had another horrific occurrence related to me by one of my patients who, with insurance, had gone to see a different doctor, and while she was worked up in the office, the nurse did the initial history, and then when the doctor walked into the room, the nurse introduced the patient by her insurance. Not a name, just this is what her plan is, so clue you into what we can charge. So a lot of medicine these days is business. It's a big business, and one of the general ills of our country, of our Western society, is that we are under the influence of so many big business interests in so many of our day-to-day decisions. How we eat is largely determined by huge agribusinesses and huge food companies that are determining, how healthy and nutritious or not our food is, but it's all geared towards the bottom line of making that company wealthy. And as you already pointed out, medicine is largely corporatized with the big business interests being the larger corporations, especially the ones that own hospitals, which in turn own medical practices, and then the pharmaceutical industry, which is just right side by side. And then the bigger overarching business is the third-party payer insurance industry, which is largely the reason why when you go to see a doctor on your insurance, you're looking at just minutes and you're not going to get the time that you think you need, often feel like you haven't been heard when you're sitting with a doctor that you're seeing on your insurance plan.
And very often the insurance plans are, okay, without saying it this way, we've bought these doctors, so you can only see these doctors on our list because they're associated with us.
Right.
So it's
We
just,
bought these doctors, and this doctor is under pressure to see 6 people an hour, perhaps more, and so do the math. It's just minutes that you're going to be in a room with the doctor.
and then the third party is the pharmaceutical company who also has their hand on the throat of the doctor, so to speak, to say, well, if you want to make some money, then you have to sell our drugs, and every time you write a prescription, we're paying you as well.
But to draw the contrast, you brought up that Norman Rockwell picture and that, kindly old doctor engaging with the little girl on her level. And what you have to imagine about that picture was this was a time where your small town doctor was somebody that you didn't just come into the room and meet for the first time. This was probably somebody who knew you. I mean, that doctor would be taking care of that little girl for her entire young life on into adulthood if he lasted that long, and would be running into her and her parents at the grocery store or in church or wherever. And, medicine and healing are a different thing when you've got a personal relationship with the healer.
Yes.
Because the healer's decision making is informed by all those little bits of information when you know about your patient.
Not only their physical condition, but their way, right? Because everybody has a different way.
Right.
Their family situation, the level of stress that they might have in their household because dad drinks or mom's, the father died and the mom's a single mom.
Right. The village doctor or the small town doctor knows all of that.
Right.
You don't have to explain it when you walk in. You walk in to see the doctor and your system is broken down because of the stress of these family goings on. The doctor knows you're having an infection because your immune system was worn down. He can go ahead and treat that, but he also knows I have to attend to the family stress, the social stress. I have to help guide you on how to proceed to heal and get out of that. You go to see a doctor now and walk in the door and somebody who's never seen you before is looking at you as a very focused problem, an infection, write the prescription for the antibiotics.
And
you're
out the door you go.
And you're done. And yes, you got something for that infection, but you didn't address the reason you got sick in the first place.
So we talked about the doctors only seeing patients typically 6 to 12 minutes. How often, what length of time do you spend with your, say, a new patient or new patient intake? What would
Well, I
that
like
be?
to spend an hour with somebody who's new.
That's unheard of.
Oh, I know that. I mean, and when I see somebody on just a regular recheck, I mean, usually standard, my visits are 30 minutes. I need at least 10 minutes to say hello. Mm-hmm. And then we can get down to business. Mm-hmm. So I need that 30 minutes. And I hate to say how many times patients have gotten up from an encounter with me and said, you have just spent more time with me than any other doctor has in my entire life, and I might be talking to somebody who's 60-something.
Yeah.
And they've never had the experience of just sitting down and being listened to.
Mm-hmm. And cared for. Because I know you personally, and I know you really do care for your patients. They become like an extended, it's your practice. So just like my practice, I do spiritual work. So I'm having super intimate relationships with my clients.
Right.
And I know them very well to the deepest parts, to their darkest secrets. So I have a love for my clients, and I watch them grow and their families and so on and so forth. But that's a specific way of being in a work. As a medical doctor, I see you having intimate relationships with your patients, actually caring about them and being concerned and doing follow-up phone calls and things like that. I mean, you truly, truly care about the people you work with.
Well, you and I mirror each other in two concepts that you started with. One is we're connected to the divine. That's what drives us. And for me, healing is my ministry. It's my divine purpose in this lifetime is to help other people to be healthy and whole and healed from what ails them. And the other issue is being holistic, that you and I can't look at any one person as their problem, as the thing that they are concerned about.
Their effect.
That is simply an effect of a whole confluence of circumstances, a whole history of where that person's been, and all of that has to be taken into account in regards to getting somebody healed. And that brings me to an epiphany that I had very recently when it was a family dinner. My oldest son's girlfriend is a nursing student. And so when we get together, there will tend to be some talk about medical matters. And I remember somebody brought up the question of nasty, bacterial infections, because those tend to make the news, especially when the outcome's, very hideous. And we were talking about the risk of those infections and what happens with that. And it came up that when you go to see a doctor with an infection, the doctor will look at it, see it's an infection, know from the situation of the infection and what it looks like, what to prescribe, and done. Takes 5 minutes. It doesn't actually take longer than that to look at a wound, redness, heat, drainage, and say, that's an infection and you really need this antibiotic. And that's just the start for me. And then the next 25 minutes of that 30 is, how did you end up being in circumstances that had you injured in that way, had your immune system depleted, got you sick in the first place? And my epiphany at that moment was, oh my God, I have spent my entire professional life getting paid for 5 minutes of my work and then doing the other 25 for free as an add-on, which explains a lot why I have a very solidly, middle-class income and, higher aspirations for everything else in my life. But then I also looked at it from the patient side, and that is the patient comes in wanting to be healed. What they're actually getting is legitimately all they need, the 5 minutes of diagnosing the infection and the appropriate treatment for it. And that's where we get so much dissatisfaction, because people go in to get health care, but what they really want is healing. The healing is a much bigger proposition.
And that's the
It takes time.
That's the
25 minutes. It takes time. It takes an in-depth relationship. It takes a broader view. It takes being holistic and stepping back and saying, wait a minute, tell me more about your family life. Tell me more about the stresses you're under. Tell me more about what you do for a living. Tell me more about the family pressures that you're under right now.
Because stress is the biggest influence on our health. So when people come to you with sicknesses or diseases or issues that they can't figure out or the other doctors have figured out, then to me I would think that they're carrying a stress load that has caused the immune breakdown, that has caused the sickness to show up.
There are very few things that I will say stress has no impact on at all. I can't even think of one right now. I mean, just about anything else will be worsened by stress. So there's always some bigger story in the background of any little, what seemingly coherent, finite, illness. One thing that you've heard me say over and over again, and I say to patients, is God and the universe don't do random. You're here today sick, you're having these symptoms, but you were well for the last 3 months, you were well for the last year. Why are you sick now? This isn't random. It isn't just because you were exposed to children. It isn't just because you traveled. There are other things going on that have allowed you to become sick, to manifest this degree of unwellness. And it's not as simple as the infection you're bringing to the doctor.
That makes perfect sense. And you have referred many of your clients, your patients to me because you've gone through the physical realm of it, diagnosed like, okay, your issue is more along these lines. Why don't you go see Ursula and see if you can figure it out?
And work on the spiritual dimension, because there is some energy that's driving a recurrent illness, a pattern of of not being well. And I see it all the time, and it's for these chronic recurring things that clues me into there's some significant imbalance in that person's overall makeup, some lack of appropriate connectedness and wholeness between their mind, body, and spirit. And that's when they need more. I mean, they always need more than just the average medical doctor.
But to the depth.
And then a lot of times they need more than this above average medical doctor.
Right. Because you also specialize. I mean, you're known for your allergy, like you're
I
an
do,
allergy
yeah, I
specialist.
practice at a specialty level in quite a few areas.
The one I was
now.
going to mention is the complicated cases. Like that's one of the things that you really love is people coming in with multiple issues, seemingly unrelated, and no matter
and
what.
usually, if you spend enough time and gather enough history, you can connect the dots and say, well, the skin condition and the fact that you're not sleeping well and, the hot flashes and, the energy level and the weight gain, all of this stuff is not 5 different things. It's actually one thing. And you're looking for a holistic solution, a holistic approach to bring you to how do you have resolution of your problems.
And you can't get that. I mean, you couldn't, that's priceless. You couldn't, pay enough to have your 7 different conditions that you're going to 7 different specialists who are giving you 7 different medicines and none of them are related and you're not really getting better. Then
Right.
they come into your office and it's like the gates of heaven have opened and you're like, oh, this is all related. This is the main issue here. This organ's not working. And, oh, by the way, this organ is related to this emotion. And where are you with this emotion in your world?
Yeah.
People are just blown away when they see you.
Yeah. Well, I'm used to seeing people come in that very situation, having seen lots of doctors, and sometimes it can get positively horrifying when you realize how many different diagnoses have been made, how many different prescriptions, some of them with themselves the potential for triggering illness. And what was really missing was one person getting to know the patient well enough to just go ahead and say, here's what your problem is, let's fix it. Occasionally I'll get somebody who comes in and sees me later in their life, 60s, 70s, and they confess that they really haven't seen doctors much, and I look at them and say, that's probably why you've done so well and gotten this far along being so healthy, because you haven't been overly doctored and had a whole lot of, horrible things done to your system to throw you off.
Because I know when we take antibiotics, it overrides our natural immune system. And if you do that over and over and over again, your immune system is like, well, you're just going to take drugs anyway, so why try?
And again, that's one of those areas where I'm looking for, if you're having to treat an infection over and over again, there's a bigger problem than even what we're doing to your system by having to give you antibiotics repeatedly. And ultimately, I'd like to take the burden off of somebody to have the side effects and the hits to their wellness from that repetitive treatment and instead get to the underlying thing that's causing their immune system to be so depleted.
Yeah. To me, our body is our message board. And what things show up is actually an expression of what's going on emotionally, mentally, just psychologically, and then, of course, energetically, spiritually.
Yeah. You and I are both going to tell people your body's telling you something. And the best thing you can do for yourself is to actually listen. And the worst thing you can do is just power on through doing things exactly the way you've been doing them and then wondering why you still have your body telling you this.
Exactly. So I really appreciate you coming on the show and expressing how you approach your work. Dr. Springer is available for consultations. You don't have to live in Atlanta. He can work with you long distance via Skype or phone. I highly recommend working with him because he's so rare and you can see so caring and true that you can't get this really anywhere. And if you're struggling, if you're out in the world struggling, like, oh my God, please send me somebody, please help me, Dr. Springer would be a prayer answered. So thank you for joining us on The Way of the Spiritual Path, the Lighter Side Network. I appreciate you coming into my life, into my world, and on the show.
And ditto.
Thank you.
Thank you.
Thank you. Thank you.